So this little joint can cause so many issues for people. And there's 3 reasons why this joint can be a bit of a bugger. So number 1 is that you've had trauma, so a punch, a fall, some sort of trauma to the face, which will misalign the jaw. So that's one reason why that jaw can be out of line. The second reason is the growth plate, so the way in which your mouth is positioned. So you might have an overbite, an underbite, a crossbite, so where it's sort of not quite in line that way. Usually the way in which our mouth grows is because of dental issues, so overcrowding, braces that haven't been properly fitted, wisdom teeth coming through. Sometimes actually children can present, so if you've had ventouse, forceps, and the way that that's clamped your head, that can change the angulation of your jaw. And the final one is actually mental health. So the jaw, if you're stressed, anxious, and have been for a long period of time, we can clench our jaw, grind our teeth, and sometimes it's subconscious without us even knowing. You're in moments and you're clenching your jaw, and all these muscles tighten up. So we then start to get this pain in our jaw, which can radiate to our head, give us headaches. So those are the 3 reasons in which this can create pain. One good way as a patient to check in is to try and see how wide your mouth opens. So if you open your mouth and see how many fingers you can get into your mouth. So 2, 3, 4. I've had braces, and I've had this all worked on. So I used to actually have some jaw issues. And I've seen a dentist who corrected my crossbite. So one thing you can do if you've been experiencing problems is just check. How many fingers can you get into your mouth laterally? So a nice wide bite is what you're after. The other thing you can do is get 2 fingers and just place them on your TMJ and very slowly open your mouth. I can actually feel that one of mine, so here you might feel one side clunking. If one side is clunking and the other isn't, there's something isn't playing, something isn't working there. Or sometimes you can actually look in the mirror and see, is my chin deviating one way or the other? So I can actually feel mine's deviating that way because this one's not moving. So when you open your mouth, is it moving straight down or is it deviating to one side? If so, that means that something's going on there. There are some practices that you can do yourself, so you can sort of massage this area. You can actually stretch your jaw. I'll do videos later down the line in which how you can help this. But the other thing that you can do is get adjusted. So we can do internal adjustments using gloves into the arches, into the mouth, adjusting the neck. So these are ways in which you can help. So if you can't open your mouth or you're grinding, either see a chiropractor or a dentist, and it will be one of those 2 things that's triggering off that joint. So I hope this has helped.